Our next presenter is Logan.
As a professional rap artist that's been on tour for the past 4 months, I'd just like to say it's nice to be here in front of you speaking. My name is Logan, and I did research with Dr. Adam Palmer in the Human Factors Psychology Department. We're looking at investigating guiding attributes in visual search for medication vials. So, back in 2004, Wolf and Horowitz, they're visual researchers. They work in the field of visual sciences, and they identified certain things that they now call guiding attributes. These are attributes, features in a visual stimuli that guide attention. They help to draw your focus towards something in the visual field. So 3 of the guiding attributes that they identified were, let's have a wait. Color, size, and orientation. And so you can see that those pop out in your field of view more than any of the other ones for the most part. So you probably didn't notice that one. It's just because it doesn't have any of those guiding attributes to guide your attention towards it. So part of the reason the main reason that we're doing this research is because there wasn't a lot of research being done on medication labeling. There's a lot of research being done on text size and, say, the caps. But on the labeling, there's not much, and it can be very confusing. As you can see, often they use what's called template labeling, where it's just kind of like a white with an alphanumeric code and a barcode, and maybe a different colored cap. Then you have the name of the drug, and you have the dosages. In a study done in 1998, they looked at pharmacy owners and pharmacists in Australia, and they found that 82% of them that were surveyed believed that there was an increase of medication dispension errors. There's a risk for that, and that's most likely because of the proliferation of drugs on the market nowadays. There's over 15,000 drug names on the market, just because there's the generic name, chemical name, and then there's name brands for a lot of the drugs. Also, confusing names, similar names or labeling were among the top 5 reasons for this increase in dispensing errors that they believe. It's dangerous. It can be deadly. A recent study found in 2010 that over 400,000 people die every year due to medical-related errors. To put that into perspective, during the entire 5-year span of World War II, there were 408,000 U.S. servicemen killed in the war. So every year, as many U.S. servicemen that were killed die due to medical errors. 1/3 of these were believed to be directly medication-related. It's expensive. Every year, medical-related errors cost taxpayers between $2.5 and $5.1 billion, and that's in extended hospital stays, operations and medications that would have been unnecessary had the medical error not occurred, and medical professional liability costs. You guys may be familiar with the Quaid twins. Back in 2007, him and his wife had some newborns, fraternal twins. 7 days or 12 days after they were born, they were admitted to the hospital again for a staph infection, which isn't too uncommon. But the nurses, on 2 different occasions, and 2 different nurses accidentally gave them 10 times the dose that they were supposed to 1,000 times the dose that they were supposed to receive of heparin, which is a blood thinner. And so they overdosed them, and they almost died. They didn't die, they're okay though. They're fine. But ever since then, Dennis Quaid has been a big proponent of reducing the confusability of medication labels. So our question, we want to know if attention-guiding attributes can actually transfer over to medication vials if you can utilize these attributes, these features, in order to more efficiently and quickly and accurately identify these medication vials. The way that we did this was we set up a study where we had 3 independent variables. The first one was text size. We had large text and small text. Then we had text orientation, horizontal and vertical. And then color density, based on the amount of color present in the labeling, high, medium, and low. So it was a within subjects 2x2x3 study. Our dependent variables, what we measured were reaction time in milliseconds and accuracy, proportion just 1 or 0. Our procedure was a 45-minute lateralized visual search task, which we created in MATLAB, which is programming software. It took about 45 minutes. We had 31 participants that were Wichita State students that participated for SONA credits. Most of them were, all of them were enrolled in psychology classes. And there were 13 males and 18 females with an average age of 21. So this is what our experiment looked like. They would be seated at a computer with a keyboard, and they would be tasked with identifying this target vowel. The target vowel would pop up for 2 seconds on the screen. It would be displayed and then it would go away. And then they would be shown this visual array with 6 vowels on one side and 6 vowels on the other. It was counterbalanced. All the vowels, there was one representation of each of the combinations of conditions. So then they would be asked, is it on the left side or is it on the right side? As you can see, the target vowel here is on the right side, so they would click the right arrow, and we would measure reaction time. We told them their reaction time and whether they got it correct or not. There were about 9% target absent trials, meaning the target just wasn't present at all on the screen, because we wanted to eliminate the strategy of them looking on one side and saying, okay, it's not there, I'm going to press the other side, so as to not skew any results. And they would press space bar for the target absent trials. So looking at reaction time here, we see vials with vertical text, small vertical text were located significantly faster than vials with small horizontal text. So orientation definitely came into play there. Here, looking at reaction time again, at the medium color density level, we found that small text vials were located significantly faster, but that was not the case at the high color density level, in which large text was located faster. Here now we're looking at accuracy, and so the higher the better. Small vertical medication vials were located significantly faster, and there was not much of a difference at the large text size level. Here, at the low color density level, small text vials were located significantly faster, and at the high color density level, they were located slower. So this is a little bit confusing. This is a 3-way interaction that we got, but the thing to pay attention to here is the small horizontal and the small vertical text. So across the board, small vertical text was located more accurately. The interesting thing is if you just switch the orientation of the text, then you get across the board the lowest level of accuracy. We found that very interesting. We actually thought the horizontal would be located more accurately across the board just because people are more used to seeing horizontal writing. So what we found was that attention-guiding attributes do in fact transfer over to medication vials, and they can be utilized in the locating of them. This could decrease the amount of time it takes for someone to find this in an emergency situation. Say you're a paramedic or you're a nurse and it's happening very quickly. You want to identify it right away and get the job done and not make a mistake. So we found that very significant. Some of the limitations of this study. So we collected over 900 stimuli off a Google image search and narrowed that down to 24 vials that we used. There was a limited variability though, so there's a trade-off between control and realism, and we decided to lean more towards realism in this study. In the future, we're going to take some more control, but for some of the conditions, there were plenty of examples. For some of them, there were very few. So that could be challenging at times. To improve the study, we'd like to better control the independent variables, such as color density, which I'll get to here in a second. Future research, this is what we had them look at for our present study. They looked at the entire medication vial. But then we thought maybe this might attract more attention than this. Maybe when this pops up as the target vial, all they're actually looking at is the green cap. So that could be a confound, and it might show us that we're not actually getting the data from what we want. So in order to eliminate that, we just got rid of everything but the label. And we had the same task, the same visual search task and everything set up, except for now it's only medication labels. References. Questions? Video.
Did you perhaps look at the earlier trials compared to the later trials? I know like certain like jobs that required your full visual attention, the longer that you were working, the more.
Vigilance.
Yes.
We had 20 practice trials, so they got a little bit of practice before we started keeping track. But we didn't actually look at the beginning, like say, we could put up the first half against the second half and compare those. Was there improvement, or did it go down? Vigilance would say that it's going to go down, just because they get tired, it becomes monotonous. But practice effect says it might go up, just because they're getting better at it. That's something we didn't look at. So. Lydia?
So we know that as people age, the reaction time is slower.
Mm-hmm.
So do you all have any plans on applying the research as far as to the public, as far as pharmacists and their assistants?
Yes, it's expensive to work with pharmacists, like $100 an hour for them to come down and do the experiment. So when we get more money, definitely, that's something that we plan on doing. We'd like to work with Brigham and Women's Hospital, Harvard Medical School. That's something that we may do in the future, but also maybe opening it up to a wider range of ages.
So two for you, Logan. One, have you thought about using the available nursing population that you have on campus for part of your studies, since it's something that is practical? And two, as you talked about removing the end caps, by doing that, do you think that that could possibly skew, since it's not very real world for them? Since when they're looking at the vial, they're looking at both the cap and the label. Or do you think that you should? Do you think that you should keep it? Do you think that you should lose it? How have you weighed that?
For right now, so we want to, at this point, we want to make sure that what we found was accurate. So if we take off the caps and everything, and we get the same results that we did, or very similar, then we can say, okay, the cap wasn't much of a compound. And we plan on creating a series of experiments, just like questions like that. Then we'll go into Photoshop and we'll make, say, all the caps red, and we'll make all the caps green. And we got a long way to go, but I plan on working on this for a while, so.
Well, the question I want to ask is that most of the labels horizontal or are they vertical? And if they're horizontal and you change them to vertical and you have people pay attention to that, are you going to have, over time, people get some kind of visual fatigue where you just see it as vertical and you get used to it and you make the same mistakes you made earlier?
That is something that we've thought about, scarcity or the prevalence of certain conditions in the medical field. So what we found was that vials with small vertical text and high color density seem to be located the most